Duncan Stephenson is from the Royal Society for Public Health, which is calling for the ban on smoking outdoors. And Ella Wheelan is from online magazine Spiked. You want to carry on lighting up outdoors?
Yes.
Even if there is sort of overwhelming evidence to suggest, presumably, Duncan, that it would actually help the health of the nation, would it?
Well, yes, since the indoor smoking ban was introduced, about 400,000 people quit smoking in that first year. And there's been a 40% reduction in heart attacks attributed just to that smoking ban. So it's had an enormous benefit to the public's health.
So banning smoking in certain places means that people, many people, thousands of people, simply give up smoking.
Absolutely.
Well, how many people do you think would give up if you banned it outdoors?
Well, we asked, and if the ban was extended to outside pubs and bars, around 1 in 3 smokers said they would switch to e-cigarettes. And that's the interesting development. It's 10 years ago since the indoor ban. 10 years ago, e-cigarettes weren't really around, but they are now, and there are much safer forms of nicotine. So for any of your viewers, if they're a smoker, the best thing they can do if they're struggling to quit is to move on to e-cigarettes.
Ella, there's overwhelming evidence from a health perspective of the improvement of people's health, the less of drain on the National Health Service as well with the smoking ban. But you're dead against the idea of extending the smoking ban to open spaces?
Yes, because it's undeniable that smoking harms your health. I think everybody knows that. I really think you'd struggle to find one person smoker or otherwise who doesn't know that it's not good for you. But the same thing can be said if we had a law that forced everyone to, you know, run around the park twice a day, people might be more fit. It's about personal choice. And I think the fact that we're really ignoring here is that adults can choose to do things that might be bad for them. The same with lots of lifestyle choices. And to introduce a smoking ban is to really kind of deny that, you know, individual personal choice, the ability for that adult to decide how they live their life.
What's your answer to that then, Duncan?
I mean, as a former smoker myself, I wouldn't say it's a choice. I think you might choose to smoke your first couple of cigarettes, but then you become trapped in a nicotine addiction. And you look at any smoker and they are kind of trying to get their nicotine fix.
Ella, are you trying to... you smoke?
I smoke.
Are you trying to give up smoking?
No, not at the moment. I think I probably will in the future, maybe when I have kids. But at the moment, I enjoy it. I know that it is bad for me. I don't do it to great excesses. There's a kind of difference here as well between people who have been smoking for years and years and years, do have a, you know, do want to give up. There are services that the NHS provides to help them along with that. It's, you know, it's all there. This is really not actually about helping people. It's about telling people what to do, which is a very different thing.
Well, except that the offshoot, whatever you think the motivation is, the offshoot is that people probably would give up and would be helped to give up. If you weren't allowed to smoke outdoors, do you think it would mean that you just went somewhere else to smoke, or do you think you would smoke less?
I think maybe it would mean that you would smoke less, but it's about getting to that point.
So it would have a positive effect on your health?
Oh, to me, it wouldn't be a positive effect because what it would be doing is completely kind of...
Well, it would be restricting.
It would be not necessarily. Lots of the numbers for the reasons why people have given up smoking is actually the rise in the price of cigarettes. So that's not to do with health at all. The fact that, you know, making people not be allowed to smoke here but can smoke over there it's not a kind of viable option.
But if you couldn't smoke outside, as Susanna was saying, you would probably cut down on what you were smoking. As you've already said, you know that smoking is bad for your health, so that would have a positive effect on your health.
It's not that it would be a positive effect on your health. Another really good example that I love using is the thing about smoking with mothers or smoking with children. People say it's terrible. People say it really harms children's health, and especially with pregnant mothers. There's another thing to take into consideration, though. It's what day that person's had, whether they really need a cigarette or not. Those kind of things are also influential on health. So this isn't just simply an equation of smoking is bad, ban it, and people get healthier. There's so much more, and I think the much more important thing is people's agency, people's freedom to decide what they choose to do with their health.
It's a crucial thing, that, Duncan, and lots of our viewers are getting in touch saying, leave smokers alone. They've had enough. We've been banned from smoking inside. We've been banned from smoking at work. We've been banned from everywhere. Just let us have a little cigarette outside in the park.
I mean, yes, there is that. It is a complex issue, and we know that there are a number of reasons why people smoke. But
shouldn't they be allowed to make the choice?
But it's not a choice. I mean, it really isn't a choice. It's a nicotine addiction, and there are much safer forms of getting nicotine these days.
So can we just establish, are you doing this to force people to give up smoking? Or are you doing this because it makes people who are not smoking less healthy because they're passive smoking?
We're doing this because well, for two reasons. One, to build on the incredible success that the indoor smoking ban has had. But two, to actually denormalise smoking. Actually, that's the key thing here. It's less about second-hand smoking here. It's about ensuring that young people, children and young people, vulnerable groups, don't actually get attracted and don't see role modelling for smoking in the future.
Yeah. And Ella, you say, let's have our freedoms protected.
I say that when you're talking about an adult pastime, smoking, you consider adults, and adults should have the freedom to live their lives as they want.